Is it time to fly to the Philippines? I know there are thousands, hundreds of thousands, perhaps even millions of people who have put off coming to the Philippines because of their continued restrictions, needing antigen tests. Anyway, the WHO, World Health Organization chief, declares end to COVID-19 as a global health emergency. COVID is no longer a global public health emergency, World WHO said Friday. The WHO issued the declaration more than 3 years ago on January 30th, 2020. He made the decision following a recommendation from WHO Emergency Committee, which met on Thursday for the 15th time. I've accepted that advice. The chief apparently has the final say on all this, and not a committee of experts. I know that I believe I've read many months ago he did not go along with other advice that the experts had. Anyway, going forward here, I think this is in the Sun Star paper. PH Philippines to reassess protocols with end of COVID global health emergency. What are those protocols? Protocols mean that people flying into the Philippines from outside the country, if you're vaccinated, you need to show some proof of vaccination. If you're unvaccinated, you need to have a negative antigen test at this point in time before you, like 24 hours before you fly, which is difficult to get because most countries have moved on from this. And it's difficult to find a COVID test 24 hours, and they don't allow the home tests. And and then there's masks wearing on in medical facilities, on trains, public transportation, and businesses can still require it. And those restrictions, just based on comments I get, emails I get, are keeping thousands, tens of thousands, hundreds of thousands, perhaps even millions of people. There are so many options to travel around the world. And why would somebody travel to a country that uh, has restrictions and requirements that other nations don't have? Like Thailand is pretty much open to anybody, and with little or no requirements or restrictions. So we are hoping that they will drop here within the next 2 weeks or month. Hopefully they will drop all that. Now there are people within the government, a number of people in the government who think that masks should go on forever and ever. Oh, it's a health safety issue. They haven't read about the Cochrane report that reviewed many studies about masks. There is a lot more information out there by top doctors around the world, many who are regularly censored. For those who are open-minded and want to search that out, Google will try to censor that stuff. So you go find a different search engine. Even DuckDuckGo, I think, a couple of years ago was caught censoring some of the information. But you can find it out there, a lot of scientific information, if you search for it. I have to be a little bit careful about what I say because these media companies, Google, YouTube, Facebook, others, mainstream media, are still trying to censor a lot of discussion on a lot of the issues, which is which is really terrible. But anyway, and we're going to get into the article here in just a little bit. Anyway, the WHO. Let's just go through the article here. With the end of the global emergency status for coronavirus disease COVID-19, repeat that. With the end of the global emergency status for coronavirus disease, COVID-19, the emergency is over. Has been over in most of the nations of the world for many months already. WHO is finally catching up with that. The Department of Health, DOH, on Saturday, May 6, 2023, said it is set to reevaluate and reassess the existing health protocols and guidelines in the Philippines. Now that should be good news. I've read a number of articles and opinion articles, and over the last, I've been following the medical issues about this since January of 2020 when this all kind of started up, flared up, even December of 2019. And there is a lot of the discussions, people who don't agree with the WHO and or the governments, they've been censored big time. Censored some very top doctors in their fields who disagree with some of these protocols and various things. So I have to be a little bit careful what I say in discussing this as well. And because even though the emergency is over, I'm sure that Google, who owns YouTube and Facebook and so many other media platforms, will continue censoring content and trying to control the discussions anyway. In a brief statement, the DOH said it will meet with other members of the IATF-EID to discuss the latest developments. Again, and we go down here, the DOH guarantees Filipino people that all factors in determining our next action in line with WHO's proclamation will be considered and discussed for the approval of the President. The DOH issued the statement hours after the World Health Organization, WHO, ended the global emergency status for COVID-19. There are other recent events that kind of hint that the Philippines may be kind of pushed in the direction of opening up completely. The U.S., one of the laggards, the United States of America, kind of lagging behind most of the rest of the world in opening up until just recently. In fact, I think just in the next few days, the requirement that non-citizens still had to show proof of vaccination to enter the U.S. Well, they're going to drop that, I think, in the next few days, as a matter of fact, for international travelers coming to the U.S. They're going to drop, I think, all requirements pretty much, including that you need to be vaccinated to enter the U.S., which will allow one of the top tennis players in the world to finally come and compete in the U.S. because he has decided no. The risks with the risks with complying with the government regulations in getting a certain injection are greater than what he wanted to go get involved in. For those who are interested and open to the scientific information, the underwriting departments of many insurance companies have come up with some very interesting information about death rates among mostly relatively young age groups over the last year that have increased rapidly. If you're interested, you can search that information out. Google might not have it. You might have to find a different search engine. Australia, some news about Australia recently also. I just saw the other day they had banned a lot of medicines are used for off-label use. You know, you have a medicine that they say, oh, we designed this medicine, this pharmacy company said, we designed it for this purpose. But a lot of medicines have other purposes. They're good at other things, and many times doctors prescribe off-label drug to use it for another condition, and it's effective there. What made the Australian news recently is that they had banned off-label use of ivermectin. There are many different videos and sites, FLCCC for one, that was recommending using and something YouTube doesn't like the mention of, and Google. But this is a news story that Australia is going to start letting people use the ivermectin drug off-label again. One of the safest medicines in the world that's used on billions of people for a number of reasons. One being to control parasitic infections, I believe. A very well-known Philippine, or not Philippine, British doctor, Dr. John Campbell. He's got a YouTube channel, a lot of good information, and he has changed his approach and his mind over the years. Puts out a video almost every day, and lots of good information there. Dr. John Campbell. But even very recently, he was censored. His video was blocked, and he's not able to put videos up for 1 week because he had a discussion with another doctor that YouTube does not allow you to talk about. Anyway, I think over the course of the next year or two, much more information is going to come out into the public sphere, and even the mainstream media will not be able to continue to censor it. It's coming out. There are discussions in various congresses around the world, and even there, we don't want to get involved in. And this is not political. I followed the medical discussions of many top doctors in the world over the last 3 years, and people accuse me of being political. Not political at all. It has to do with the science and follow the evidence, and that's what this Dr. John Campbell. He's got a couple posters up in his office where he does his videos and says, "Follow the evidence wherever it leads." And there are those in this world who, perhaps because they are, is there conflict of interest when news sites are funded a big part from big pharmacy? Could that be a conflict of interest? Could that be one reason why they try to move the censor and move the conversation away from a lot of the scientific discussions going on presently? Anyway, I better end this video before I get in trouble with YouTube. You know, Mama's watching, Mama's watching, Mama YouTube, watching over us, making sure we don't hear things we shouldn't be hearing. Can't be discussing things we shouldn't be talking about. Dirty words. Anyway, I'm going to end it there. Anyway, hopefully in the in the next month or so, we'll hear some really good news that the Philippines is dropping all restrictions and requirements for travel. And those of you who have been hesitating and putting that off can finally make your plans. One of the problems in making plans is if you have that suspicion that the government's going to change its mind quickly again, and hopefully with they'll kind of be pushed kicking and screaming into the modern world here, and open up and stay open for the extended decade, 2, 3, 4, 5, and we won't have to deal with this again.